Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter R. Actually, I tend to talk about this rheumatoid arthritis long ago, but when I start the letter R, but I just defer it until today because I thought this is one of the most common conditions. So I just think I spent a little long time to talk about this. In terms of the, let me just bring up the first emergency situation associated with this rheumatoid arthritis. Probably I couldn't think of anything, any particular emergency situation associated with this rheumatoid arthritis. However, theoretically, there are some conditions really life-threatening, but it's not common. There's a theory saying that indicating if the rheumatoid arthritis occurred in the cervical spine, which is quite dangerous. It could be really severely impaired the joint and also cause the paralysis or even life-threatening because it's the junction of the spinal and medulla oblongata. If that's the case, the rheumatoid arthritis might cause the damage of the life center, which is the medulla oblongata, the center of respiratory, cardiovascular, and also all the other functions. So if that's the case, it is life-threatening. However, that is really the theoretically speaking. Probably it's not common. It's very, very rare. It could happen though. So this is about rheumatoid arthritis. Can you manage at home? Probably not, because this is autoimmune disease and it's quite serious actually. If not treated, eventually will lose the function. So it has to be managed by your physician. Even though during the remission time, no flare up, you probably have this period of time not taking medication, but still has to be followed up with your physician. Otherwise, the prognosis probably will be very bad, very serious. So this is about rheumatoid arthritis, the two ends, emergency or manage at home. Basically, it's not, you cannot manage at home or not much of an emergency situation. However, it's one of the most common conditions occurring a female more than male, and start from young age or early middle age, or young actually, around 30s. And also the affected joints are the small joints. It's not the large joints like the knee, the shoulder, the elbow. It's usually the interphalangeal joints and also the metacarpal joints or metaphalangeal joints. So this is about the location and the spared distal interphalangeal joint, which means usually on the second joint of the fingers. If I explain, this is the distal interphalangeal joint, and this is the proximal interphalangeal joint. So this is quite common, but this is the spared. If you ask me to explain as the common language. So and also it's symmetrical. Usually it's not just one right hand or left hand together. And if it occurs in a large joint, usually not common, but the large joint could happen, but has to have the small joint together. Will not just affect a large joint. If that's the case, it's not rheumatoid arthritis. And also in terms of the other risk factors, is genetic, human leukocyte antigens, which is special type DR4. So if you or your family had this rheumatoid arthritis or carry the special type of genes, then that increase the risk. So if that's the case, you probably need to, your physician probably will address that to you, whether you have risk and whether you want to be tested or not. In terms of diagnosis, it's really straightforward clinical criteria, scoring system to diagnose this rheumatoid arthritis. That's the physician. Everybody has this the criteria to look for, and also including the lab test, serology, which means antibody test. And there's some antibodies quite straightforward, specific. Some of them are not specific. So this is the and also the rheumatoid factor test is quite sensitive, but it's not quite specific. So this depends on, and many other conditions can have this rheumatoid factor test positive, but doesn't have to be rheumatoid arthritis. So this is, I think, if you are at the risk, if you met the score, clinical presentations, your physician will address this, will talk to you what kind of test to explain to you. In terms of management, usually anti-inflammatory or immune modulators or DMARDs. There's a classic, is a biological or non-biological, like a methotrexate. Everybody know it, and all the Humira, you probably heard of it. So this is depends on your condition, depends on your physician's preferences, individualized to choose different medication for you. In terms of prognosis, I think there's no cure of this rheumatoid arthritis. You probably have the remission time, which means intermission time, which means there's no flaring up or symptoms getting better, improved with the short-term treatment, but eventually will flare up once in a while, also has to be treated. So the point I'm saying here is you have to be followed up with your physician regularly, particularly if you feel like the symptoms coming back, the joint pain is coming back. If that's the case, you really need to restart medication. I think usually it's just continuously to slow down the progress, to improve the prognosis. In terms of rheumatoid arthritis, whether there's some systemic conditions associated with this, rheumatoid arthritis could be one of the systemic other diseases, autoimmune diseases. Really depends on the individual and the diagnosis. And sometimes the rheumatoid arthritis could impair the nerve function, cause the alter the mental status, or faster or progress to the degenerative change, either the joints or the nervous system, and also could be associated with other autoimmune diseases, like I mentioned. So this is about the rheumatoid arthritis. It's quite common, and particularly for young people, young female, if you have what I mentioned. And also there's another important sign I think I did not mention, is the stiffness in the morning. When you wake up, you feel that your joint is very stiff, and associated with pain. The stiffness lasts longer than 30 minutes. Not like some arthritis just caused by the degenerative or chronic inflammation or something else. But this is the long-lasting stiffness associated with the pain. If you're a young female, if you have family history, particularly if you have family history, or if you, even though you do not have family history, if you have this kind of symptoms, in the morning your joint feel stiff and pain lasts longer than 30 minutes, that's really a sign to talk to your physician and see whether you meet the criteria to diagnose the rheumatoid arthritis. So this is about rheumatoid arthritis. Probably it's so common term, you probably heard of a lot of times. Many people have it. Because the medication now, I think it's really not, I mean, the prognosis is much better compared to 3 or 4 decades ago. So I'm going to stop here today, and hope it helps. And for those young female, just if you have the symptoms I mentioned, you probably really consider to talk to your physician to get tested, or to talk to them to either diagnose or exclude. So then if diagnosis earlier, definitely will make the prognosis better. So I'm going to stop here today, and hope it helps. And thank you for watching. I will see you next time.